Okay, so first question, what is your full name and title?
My name is Jen Williams. My title at work is a perinatologist or a maternal fetal medicine specialist, which is a
Okay,
subset
awesome.
within OBGYN.
Gotcha. Okay, so then what degrees do you have?
So I actually have a BS from Michigan.
Mhm.
I have a B from Michigan, and I have a master's actually that's not required by this field. It was just sort of an extra thing that I did during my fellowship. And it's kind of it was in the School of Public Health. It's kind of like a master's of public health or an MPH, but I actually did a little bit more of a business degree with that. So it's called an MHSA, which is a
Okay.
Mass Health Services Administration.
Mm.
A little bit of the business side of medicine in that degree, and then a lot of sort of financial implications on overall public health.
Gotcha. Okay. So you kind of just did a little bit there, but would you mind outlining kind of where you did your undergrad, graduate, and then any residency or fellowships?
Yep. So believe it or not, I'm like through and through U of Mer. So undergrad, med school, and the master's at U of M. I did residency at U of M. And after residency for OBGYN is 4 years. And at that point, I practiced for 2 years at Michigan as a general OBGYN. I wasn't positive I wanted to do a maternal fetal medicine fellowship at that point. So I just did 2 years as an attending physician at Michigan.
Okay.
And then I did 1 year out in Denver as an OBGYN at a safety net hospital while my husband was doing his fellowship. Bob did a fellowship in sports for a year out in Denver. And so I worked out there as a generalist. And then at that point, it was kind of my third year of general OBGYN, and I had decided that I was really interested in more like high risk, complex pregnancy.
Mm.
And I was kind of, having kids, and I thought, I'm willing to give up some of this other stuff, like gynecology, basically,
Right.
as a trade-off to really getting the additional training to focus in on high risk pregnancies, both from a maternal and from a fetal aspect. And so then I went back and did 3 years of a fellowship at Michigan.
Okay.
Although it's a pretty research intensive fellowship,
Mhm.
so it felt a lot different than being a resident at that point.
Mhm.
Um, like it was still hard, and you still aren't getting paid as much, but it was more like very academic, very research based, a little bit more control over my schedule. And actually that's when I did the master's. So it was very education based. I did
Gotcha.
still do a lot of clinical stuff. Um, Particularly with ultrasound and with the high risk maternal population, but it also involves at least a year and a half of just like straight research.
Okay, gotcha.
Yep.
So then after medical school, how long did it take for you to officially start practicing kind of in your field?
So, I mean, I've practiced for 3 years as a generalist. So
Mm.
that was 4 years after med school.
Mhm.
And I did that for 3 years, and a lot of people stop there.
Right.
And it's pretty fruitful. And I worked at the university for the 2 years, and then at the safety net hospital. So I got to experience kind of like two different environments of that, both with pros and cons.
Right. Gotcha. So then when you were applying to medical school, what do you think helped you get in or made your application stand out? So GPA, MCAT, extracurriculars, other stuff.
So I was a little bit different in that I was in one of those combined programs. I was
Mm.
in the combined program at Michigan. So I, technically speaking, got in right out of high school,
Oh wow, okay.
so I never even took an MCAT.
Oh
Um,
wow.
Pretty weird. And don't totally like, I don't think there's a lot of those programs left now because they really do, like, you miss out on a lot of I would say the rigor a little
Mhm.
bit of being a
Right.
pre. I think you miss out on I don't know, it's just a little different when you like kind of don't have to take the MCAT. You know what I mean?
Right. Yeah. No, that
It
makes sense.
that it it was really a great program for some of my friends. For me, I ended up actually um going off track with my classmates and doing a year of research when I
Mm,
was a senior, because basically the program would have required me to be a senior when like all my friends who weren't in that program were like real seniors and I wanted to
right.
be, and like
Okay,
do
yeah.
things and so I did a year of research that year, and I do feel like that helped me. I think
Right.
research is a hard thing when you're doing pre-med classes to always have like complete buy-in. I didn't want to become a doctor to like be in a lab like giving
Mm,
mice cancer and then giving,
right.
oh, and but I definitely felt like that helped me. I don't know if that's changed, but at the time I felt like that was something that like people were always like pretty like, oh wow, you did this mouse project.
Right.
Um,
Gotcha.
so I do feel like that helped, but yeah, my course to med school was a little bit different in that way.
Gotcha. That makes sense. In med school, is there any misconceptions that you feel like a lot of people have about medical school or the application process?
I feel like to me the biggest misconception is that you have to give up your whole life.
Okay.
Um, that was really stressful for me when I was like kind of deciding, to become a physician and to even like go to med school was sort of like, well, I have all these other things I like in my life. Like I like to hang out with my friends. And I mean, even simple things like I had gotten advice from someone who was my dad.
Mhm.
And he was always like, when you're a med student, like you're not going to have time for all this nonsense, and you're not going to have time for, like, I mean, even silly stuff like girl stuff, like, to like do your hair, like in
Right.
the get ready, or like, stuff
Mhm.
like that. I was pretty turned off by that because I was sort of like, I actually still want to do everything that I want to do. And I'm only really intending on this being like a small part of my ego. I mean, it's a big part, but I was not necessarily like looking at it like I'm going to give up everything else in my life for this. I was always
Right.
kind of, I think I would love this field. I think I would, still love all the other things that I want to
Mhm.
accomplish. I knew I always wanted to have a family, and I didn't like looking at it now. I'm kind of like, you don't have to look at it that way, and you shouldn't look at
Right.
it you know
Right. That
it's
makes sense.
no question that it's rigorous,
Mhm.
uh, but I think that it just like it's a little bit of like the personality of the people who go into it. You're probably going to be pretty rigorous, like whatever you do. Like it's not a field that people dabble in and think like, oh, I'm kind of a serious person.
Right.
It's like usually if you're doing it, you're like a pretty serious person right out of the
Right.
gate. But for me, I liked the element of like you can be serious at a lot of things, like work hard, play hard, kind of
Right.
that
Right.
mentality, or where I was. And that's not how everyone is in the field for sure, but there's definitely a population of people like that.
Gotcha. That makes sense. Um, in your undergrad or graduate schooling, what was one class that stood out to you that you really enjoyed?
Mm, that's a really good question. So, um, I didn't love a lot of my undergrad
Mhm.
classes, to be honest with you. I like
Okay.
sort of had my eyes on the prize of the eventuality of what that would bring to me.
Right.
Um, so I can't say that I loved those classes.
Right.
Um, Like I was more, trying to become a young adult. Like I loved this music class I took that was like
Right.
intro to different styles of music. I wish that I had had some of the classes that I had like during med school or during my public health degree in kind of like lighter form as an
Okay.
undergrad. I was very interested in learning about like things that adults talk about.
Right.
Like what do people mean when they, so for me it was a little bit of like box checking the undergrad
Mhm.
experience, get to the good stuff. I do think
Right.
that some of the undergrad curriculum has changed in that realm now. Like, it's like you hear adults talk about stuff like Medicaid and Medicare and, you know, like global health needs and like, oh, this and that. And it's like, you're going into medicine, but you don't learn about that at all, or
Right.
like you hear about like, oh, there's an obesity epidemic, but like you don't learn anything about nutrition.
Right.
It, right. I think it's changed though, where people are. I think you're all set. Um, so I think it's changed where they're trying to get sorry, Zach.
No worries.
Um, even like, my kids who have done, yeah, I have. Um, my kids have done some stuff where they've like even gotten a little bit of that, like at Skyline in the Health Med Magnet, like
Right.
they've gotten a little bit of like practical stuff. Hey,
Right.
Cal. Okay. They've gotten a little of the practical stuff, like, Luke, I think in one of his classes, like learning about sickle cell anemia.
Right.
It's like a little bit like of a closer carrot,
Mm.
you know, like, okay, I really like don't want to learn about chloroplasts all day long,
Right.
but but if you tell me why plant biology might be important because they lead to this like pharmaceutical development and that kind of thing, like then I'm going to be more apt to be interested. And so when I got to all the classes, I mean when I got to med school and all the classes were like pretty tangible to like what I wanted to do. And then I'm a little bit of an experiential learner, so then when I got to like the rotations, like then things just like started to click and buzz, and it was like, yeah, like sometimes it's hard to be like a very intelligent young adult and just observe, but
Right.
other times it was like if you actively observe, I'd be like, wow, that's a crazy story that person has.
Right.
Like, and I learned a little bit about like liver cirrhosis, a little bit about the Vietnam War, a little
Mhm.
bit about like diabetes, a little bit about like esophageal varices, like in one 30-minute conversation with a patient, And then to top it off, I learned like his life story, and it's, like kind of amazing what people go through, So
Right.
that kind of, I would say, when like for me, like the passion of it kind of set in. It took a while. It
Right.
took a while. It wasn't like all in, like these are great. I mean, I definitely had a very close, like the year I took off and worked in a lab, I was kind of like, I'm not really sure this is for me. Like,
Right.
I'm hanging out with all these like crazy studious people all the time. And, I kind of like had to do some soul searching that year for sure.
Gotcha. Um, so what inspired you to go down your certain specialty in medicine?
I would say that I thought for sure that OBGYN was like the one field I wouldn't go into.
Okay.
But part of that's the personal experience of like my father and my grandfather are both general surgeons.
Mm.
My father was vascular, but it's like a little
Okay.
subset of general. And I really felt like that's what I would do. But part of that was like a little bit of like kind of their personalities were like, this is the field you go in when you're like a badass. You know what I mean?
Right, right,
And I considered myself one. So I was
right.
like, I'm gonna do it. But I loved birth right out of the gate. I really didn't have any experience with OBGYN. Um, I didn't know that OBGYNs did surgery, like
Mm.
that they do anything in the pelvis is actually done by a gynecology trained surgeon, not a general surgeon. I didn't know that, hysterectomies and taking out people's ovaries and pelvic cancers were the gynecology path, and
Mm,
rather than, the general surgeon path. So that was like really new for me. I really loved birth, but I definitely really loved the operating room.
okay.
So when I first decided on OBGYN, I thought I was going to do gyn onc, which is, more of like a more pure like surgical subspecialty. And that was kind of in alignment with like sort of my familial brainwashing.
Right.
Um, but actually the more I kind of got into it, I was like, I kind of love both areas. And I really felt like I really like felt like if I have to give one up, like it's easier for me to give up like an 8-hour surgery on a cancer patient.
Mhm.
It was like easier for me to think about giving that up than it was to think about me like giving up taking care of pregnant women.
Right.
And and part of that's the passion for the science, and part of that was like the passion for my life outside the hospital. I was sort of like, I feel like this other thing might work better with the fact that I now have like 2 kids and I
Mm,
want to have more, and I'm really kind of enjoying that part of my life too. And so it definitely like kind of fell in. And definitely my husband, like, he played a role too, because I
mhm.
think he was a little scared about me going into gyn onc just from a lifestyle perspective.
Right.
You know, he was kind of like, um he didn't come from a family where there were doctors, so he
Right.
like came at it with like a totally different perspective, like why would you ever do that, like why would you ever like that 12-hour surgery and like give up this and that and like give up time with me and the kids, and
Right.
so, like he didn't come from that same like Kool-Aid kind of mentality. And so it was like kind of hard for him to even see like why that would be on the plate for me. But
Right.
I think ultimately it was a combination of like sort of listening to someone's perspective who I really valued,
Mhm.
with like loving two things, and then kind of like figuring out what part of me like wanted to do it because I loved the science behind it, which I really did love gynec surgery
Right.
and the science there, but just figuring out like what's going to actually work with my life and make me happy in all realms.
Gotcha. So what makes your specialty unique or kind of you think separates it most from other specialties?
I think like people talk about maternal fetal as like, oh my gosh, your field that must suck. Like all you do is deliver bad news, like
Right.
how do you do that? Because we deliver a lot of bad news,
Right.
if back in my week last week, I'm like, I had to tell one like 39-year-old with an unplanned pregnancy that her baby probably has either a serious genetic condition,
Mm,
possibly Down syndrome or trisomy 21, but it looks like on a very early 12-week ultrasound, like it's a really serious thing and may not even be compatible with life.
right.
Um, talked to another patient about her baby is missing the fibular bone in the leg and the
Okay.
foot on one side, and those things are really hard, because they're devastating, and nobody assumes that like it's going to happen to them kind of a thing.
Right.
But it's never depressed me. It's always kind of made me like more impressed by like the strength of humans and the things that people are resilient about that are like super inspiring to me.
Mhm.
um so that part's unique. I mean, we do deliver a lot of bad news, and then on a different day I might just be taking care of a type 1 diabetic who happens to be pregnant and everything's fine with the fetus, but she has medically some more needs to make sure everything stays fine with the fetus and stays fine with the pregnancy. On a different day I might be at the hospital, with a mom who's hemorrhaging, and
Mm,
and then she ends up being okay, and that's really great. So I like the variety. I think, being just in maternal fetal, I just do obstetrics now. So it's not as much variety as like an OBGYN might see. Um, but I like that. I like the fact that you can create like you're a little bit more of like a commodity, so you can,
Mm.
make some demands of like what you want. For me, the luxury of kind of being a little bit more rare in terms of like your type of training
Yeah.
gives you options. Like, well, like our hospital might need X number of MFMs, so then I can say, but this is the way I want my day to look. This is the way I want my practice to look. Like, maybe I don't want to like see patients after 2 o'clock on
Right.
Fridays. I feel like I have a little bit more leeway to dictate my own, like I have a little more autonomy by being a
Gotcha.
little bit less like common. And
Okay.
I like flexibility and autonomy. Those like are very important like words in my
Right.
vocabulary.
Right.
And I mean, maybe another way for saying that is like liking control, but like, part of the physician satisfaction data really centers around like, do you feel like your commitment to this field has resulted in having autonomy and flexibility in your life? And if the answer to that is no, then of course you're going to get burned out, and of course you're
Right.
not going to be.
Right.
If you work really hard, like presumably you're doing it so that you have some degree of control over your schedule, your life, your decision about taking a vacation, stuff like that.
Right. That's super interesting.
Yeah.
Um, so what does an average day look like for you?
So I work part-time. Um, and so every third week I work full-time, and that's my on-call week. And so
Okay.
I'm on entire week, and we cover inpatient consults at the hospital. So I'm usually at the hospital for most of the day on those days. When I'm not seeing inpatient consults, I'll probably be like back in my office reading ultrasounds that are happening off site at a variety of different sites, like satellites around, kind of the greater area. We have one in Brighton. We have one on the west side of Ann Arbor. We have 3 machines right in Ipsy. And then we have 2 machines at St. Mary Mercy in Livonia. So we're kind of scattered, like meaning that the machines and a sonographer are at each of those locations. And then like I can read the images from wherever I am.
Gotcha.
And oh, that's what that week looks like. And then the other weeks I'm in the office at our main site usually, which is in Ipsy. And at that site, a typical pattern would be like a patient would have their ultrasound and then they would see me after.
Okay.
It's pretty like typical. We get a little more time with patients as a specialist, which is really nice. Um, I like to gab. So, I definitely like having the extra time with people. And
Right.
sometimes there's time to gab or catch up or, relationship build. You're just kind of like, I got to tell them this, and this. And like, we got to get through that like factual information. And that takes up, way more than a half an hour. And
Right.
you're running that kind of stuff. But, there's a lot of rapport building. We do a lot of co-management. So they'll still have their OBGYN, but they'll see us just for like on the days that they have like a high risk issue, ultrasound, meet with us, and then they'll still like do all their usual stuff with their OB.
Gotcha. Okay. So how many hours do you work a week usually then?
Oh, that's a hard question. It's like it's definitely probably I would say on my not on call weeks, which
Mhm.
technically I have Fridays off.
Mhm.
I usually am still doing work on Friday, and I
Okay.
definitely put more than 8 hours every day. I mean, I would probably say on average, I put in like 10 hours a day, but the
Okay.
flexibility seeps into other days. So, I mean, maybe it would be 8 to 10, but between like meetings and looking stuff up on my patients and doing
Mhm.
all my charting, which I might do like at home. My husband does nothing at home, whereas I'll leave my office by like 3:15 to pick up my kids from school. But like because I left early, I definitely am gonna have to like go back either when they're at dance or in bed and do a couple more hours of like charting and reading ultrasound later. So I mean, I would definitely still say, even though I'm part-time, that I work more than, I mean, probably more than 50 hours a week,
Okay.
but definitely more than 40 hours a week.
Gotcha. Okay. So how many patients do you typically see a day?
So because we do a ton of ultrasound,
Yep.
we do, and so normally, I would see like probably about 11 in a full day, which
Okay.
is not a lot compared to like a primary doc or even
Mhm.
my husband, he'll see like 40 a day, stuff like that. But but our visits are super comprehensive. Like we're running through the entire medical history and all
Right.
this. And we see predominantly new patients. So we kind of like see a new patient, set up a co-management plan. And there are people that I see back every month the rest of their
Mhm.
pregnancy. There's also people that like I kind of set up the plan, and then like our nurse practitioner will see them for the bulk of their return visits. And I might just like a straightforward set of twins might see me for the first pregnancy or the first consult, but then after that she'll see the nurse practitioner unless something comes up, and I'll read her ultrasound, but the nurse practitioner will like see her after that ultrasound, and she'll kind of say, yep, no changes in the plan, blah, blah, blah. If something comes up on the ultrasound, like one baby's not growing, the other one's
Mhm.
fine, but one baby's not growing, then she'll get looped back into seeing me. Like, okay, do we have to deliver you early because one
Right.
baby's growing, that kind of thing. Hang on one second, Zach.
Sure.
Um, and so, that's kind of like how we would do that.
Gotcha. How competitive is the job market in your industry?
I would say that I would say that it's competitive to get a fellowship spot in maternal fetal. Like a lot of things in medicine, it's kind of like it's been a little bit like right sized, almost maybe not quite right sized. Like
Okay.
there's not enough MFMs. Like I
Okay.
think I think we know that. So, the downside of that is like there's a lot of work that you have to do. The upside of that is that the fair market value for pay is like quite a bit higher
Okay.
because there's not a lot of you. So
Right.
like in the universe of like competitive markets and things like that, you can negotiate like a better contract for the amount of like physical time that you're putting into it because you're a little bit more, and that kind of is like that basic econ principle, but like if you're a little more of like a commodity.
Right.
Um, and so that's a nice element of it.
Gotcha. Okay.
You know,
Um,
overwhelming too because there's like a lot of variables and there's a lot of high risk work to do. I mean, we
right.
live in a country with a high risk population baseline.
That makes sense. What skills do you think you have that make you good at your job?
This is so interesting. I I think that I think it makes me good at my job that like I'm a warm person. Like I like people a lot. Like I like talking to women about their pregnancy. I feel like, I kind of have a little bit of that like soulful element about like if something bad's happening to you, like how, I have a lot of compassion,
Right.
empathy, that I feel that my patients feel that from me.
Mhm.
Um, and and that's not everyone's personality. You know what I mean? Like I would
Right.
talk the next 3 hours if you wanted
Right.
to. Like that's like that is my personality. You know what
Right.
I mean? But in my field where everyone comes expecting a normal outcome, no one comes to a pregnancy. Like I always say, like it's harder to do our job than be a cancer doc because as soon as somebody says the cancer word to someone,
Mhm.
they'll look at their doctor and be like, oh my God, like you're going to help me. But
Mhm.
as soon as you meet someone and tell them there's something wrong with their baby, they kind of want to hate you.
Right.
Like they're kind of like, what the hell are you talking about? Like, everyone has a healthy pregnancy. I've done everything right. Like
Right.
everyone has a healthy pregnancy. Like, what do you mean mine's not? You know, and so you do get that difficult interaction like quite regularly.
Mhm.
But I feel like, you know, I find that a little challenging, and like building the rapport after, you know, delivering bad news. I think, you know, it's a different thing, and you have to have the I think you have to have the like kind of emotional capacity for it, and just kind of the interpersonal capacity for that.
Gotcha, that makes sense. Um, what's your best tip for balancing work and life or school and life?
Um well, I'm not going to claim that I'm an expert in balance. But, you know, I have 5 kids. I work
Right.
part-time. I love my job. Like that's a lot of the good balance
Yeah.
point, right? Like there's a lot of like toxic doctors,
Mhm.
and definitely I'm not one of them. You know, I really like what I do. I find a lot of balance on many days, and then there's days that are out of balance. But I think, you know, my biggest thing that I'll like say to people like in your age group is always like meaning and purpose. Like you're never going to I have 4 siblings who are lawyers,
Mhm.
and out of them, 2 of them love what they do and 2 of them don't.
Right.
And you know, so for me, I look at really like I look at that, and I find myself being like, medicine's a pretty good place for people who wanted balanced life, because there is some paradigm for it. And there's some paradigm for cross coverage and things like that that I really don't think there is in the law, you know. And I think because men are more involved in their families now than ever, and like this generation wants to be more involved. And I think like it's not just a conversation to have about like women working part-time. It's like everyone wants control over their schedule and some flexibility and autonomy. And, you know, so I just always say to people, if you start with meaning and purpose
Mhm.
in like most things that you do, you're going to get there and be satisfied.
Right.
Like if your job doesn't give you meaning and purpose, you're going to look for meaning and purpose in other realms, which is great, right? Like maybe you own a bunch of McDonald's. Like
Right.
you have a good living. You might feel a little bad that you're like contributing to the obesity
Right,
epidemic,
right.
but you're like, but I'm making a good living for my family. I'm gonna like be really involved in this charity. I'm gonna be really involved in this like part of my community. You know, I'm gonna be really involved with my friends and my sports.
Mhm.
But the nice thing about medicine is like every day you go to work, you have meaning and purpose. Like every day you're making a difference for one person at least,
Mhm.
sometimes so many.
Right.
And you kind of get that validation on a super regular basis. It doesn't mean you don't still go looking for it in other realms of your life. It just kind of leaves you a little bit fulfilled. And then if you can kind of learn how to say no to stuff, I think that, you know, you have to like say no. I was just talking to Jack
Mhm.
about like, you know, at the end of the day, there really are only 24 hours in the day.
Right.
And, you know, people will be like, oh my gosh, you know, I don't know how you do it. And, you know, you are sometimes kind of like, well, it's not magic. Like you do it with sacrifice,
Right.
and you do it with, lack of sleep. And you know there's a cost, right? Like there's a cost to like having a bunch of kids and working as a physician, like, you know. And it's not like some magic like, oh, I don't know how you do it. It's like, well, you know, like I haven't actually been to Europe in my life, believe it or not. I'm 50 years like, you know, I mean, there is a cost. I like haven't done a lot of stuff that like maybe without a pandemic, and like, you know, that was a little setback, and you know, a lot of kids and stuff like that. But you know, there is like a cost. But if at the end of it you look at it and you're like, you know, but I'm really fulfilled in my job, my personal life, like I think you just have to like you have to go after meaning and purpose, and then you have to find some room to say no to some of the stuff. I said no to Europe. Like,
Right.
I want to go to Europe. Like, I will go there someday, right?
Right.
But probably after my kids have already gone. But like they're like you're always in pretty good shape if you have the meaning and purpose in your day-to-day work where you spend a lot of hours. And then from there, if you learn how to say, but there is only 24 hours in the day. So like if I have this exam
Mhm.
and I have this like social event I want to go to, and I have, this basketball practice I need to go to, I might not be able to lift for 2 hours today.
Right.
And that's a cost, but like there's only 24 hours in the day.
Gotcha. Okay, so last question here. It looks like the Zoom's about to close in a couple minutes.
Yep.
Uh, After a long day or kind of a lot of running around, what's your go-to relax activity?
I'm definitely like not as hobby oriented as some. I wish I
Mhm.
was. I played the piano for a couple years. That was
Okay.
great. My go-to is literally just observing my children. Like I could watch my like girls forever. I could go to a basketball game and watch the boys. Like if I'm finding my happy place, I could go to the pool and just like watch them jump in and out of the pool.
Mhm.
Like that's like my zen place for sure is my kids.
Gotcha. Awesome. Okay, I'm gonna stop the recording.